Hi, I'm Dr. Cait Hauser. I'm an OBHG hospitalist and site director in Virginia, and I'm here to tell you about a life save we recently had at my hospital. I frequently work night shift, and so I had a patient who came in and needed a C-section. Her private practice doc happened to be there, so he performed the surgery. He then came to sign out to me, told me about the patient and the case, and then he went home for the night. A few hours later, I was called bedside because the patient's blood pressure was low. We went bedside, I did an exam, we got labs, anesthesia came, we gave her fluids. I did an ultrasound at that time and I didn't see any blood in the uterus, any blood in the abdomen, and we awaited the labs to come back because she started to improve. Within 30 minutes, she had low blood pressure again. I went bedside and now she had blood inside of her abdomen. We also had the results from the CBC back that showed her blood counts had dropped from 11 to 7. And now my concern was that she's bleeding into her belly. So we urgently opened the operating room. I called anesthesia. I called the patient's private practice doc to let him know, and he wanted to come in. So he came in. We activated massive blood transfusion protocol and got uncrossed blood to the patient as soon as possible. And we wheeled the patient urgently to the operating room. When I entered her abdomen, we found 4 liters of thin red blood in her abdomen and around her uterus. When I was able to get all that blood out, we were able to see that there was a part of the uterus that was bleeding. We attempted to close this space to stop the bleeding, but the bleeding was ongoing, and we made the difficult decision to perform a life-saving hysterectomy for this patient. We had GYN oncology called in to help assist us with this difficult case, and we were able to take the uterus, no problem, and her bleeding stopped. We then looked around, made sure everything else looked normal and there was no bleeding, and she was sent to the ICU to recover. In total, she received 4 units of blood, and she was discharged post-op day 5 in stable condition. I think this case really highlights the importance of OBHG and the importance of OB hospitalists in the hospital. If I had been at home, I would have been relying on nurses telling me what's going on. I wouldn't have been able to present to the hospital as quickly. And this patient needed expedited, urgent bedside evaluation and expedited, urgent surgical intervention. And so I think this just speaks to the importance of OBHG and the work we're doing. I'm so proud to work for OBHG and to be able to provide this life-saving care for the women in my community.